Good evening. A pharmacist from Oxfordshire says he believes his businesses have been abandoned by the government and forced to source their own protective equipment. Stuart Gale runs Frost Pharmacies in Banbury and Oxford and believes they provide a crucial service but are being put at risk. Last week, the government announced £300 million in funding to support community pharmacies. Jeremy Stern reports.
Staff at Frost Pharmacy in Oxford deal with sick people every day and they're taking no chances. Masks arrived this morning from China, paid for by the company. Its owner has called for extra support from the government.
We're completely unrecognised, completely undervalued. My staff and pharmacy staff around the country are doing an unbelievable job in unprecedented times with a huge increase in volume, when at a time when they're already on their knees because pharmacy is so broken.
The government recently pledged £300 million towards community pharmacies, but the National Pharmacy Association says some branches were already on the brink.
We are supplying medicines to the nation, and what we don't want is that supply to dry up because our frontline teams start to fall over. And they will begin to fall over. We've seen the number of people in our team self-isolate to the tune of 20%. If that number goes up much further, clearly we will see pharmacies having to close.
The government said today that Public Health England has revised its guidance and pharmacists don't necessarily need protective equipment if they maintain social distancing. Last week, the Prime Minister did recognise their work.
I think how important it is that our pharmacists are not only dispensing vital medicines, but also very often reassurance to the customers they interact with. So thank you to our wonderful pharmacists for everything that you are doing.
A sharp rise in the number of paid-for prescription orders isn't helping. The Oxford West and Abingdon MP has backed calls for immediate action on this.
The issue is the administrative burden. So if there was a temporary freeze, which was paid for by government to allow pharmacists to focus on what's really needed, including getting protective equipment, including making sure that we have the medicines that we need in order to be able to stay at home, then that is a better use of their time.
The pressure is building, but there is some positive news. NHS England has announced it will fund protective screens and shields for all pharmacies. Jeremy Stern, BBC South Today.